Good morning to all of you who have joined us for the 8th British Congress on Medicine and Spirituality. On behalf of the International Spiritist Medical Association, I would like to thank all the organizers of this event for giving us time to present something about the International Spiritist Medical Association and the Spiritist Medical Associations in general. So the International Spiritist Medical Association was founded by our beloved Dr. Marlene Nobre, who probably some of you have met. Dr. Marlene Nobre was the founder of the Spiritist Medical Association of São Paulo, Brazil, which was the first organization being founded, and this was in 1968. Later, in 1995, she founded the Brazilian Spiritist Medical Association, and then in 1999, she founded the International Spiritist Medical Association. So you see that she was devoted to the cause of Spiritist medical associations, and she devoted a great part of her life to this cause, promoting new organizations, helping in the formation of new organizations, helping to spread the word on spirituality in the practice of medicine. When Dr. Marlene Nobre founded the International Spiritist Medical Association, there were with her representatives of 6 countries. Physicians from Argentina, Brazil, Colombia, Guatemala, Panama, and Portugal. At that time, as you have seen before, the Brazilian organization had already been founded. Of these 6 representatives, 5 of them became officially affiliated to the international organization. Argentina, Brazil, Colombia, Panama, and Portugal, who are affiliates to date. Dr. Marlene Nobre led the organization until her passing in 2015. By then, 2 additional organizations had joined, Switzerland and the United States. So we're counting 7 organizations to that time. Now, I'm very happy to announce that we have new affiliates. We have the British Spiritist Medical Association that has been formed and is ready to join us, and is led by Dr. Peter Fenwick, Dr. Natalie Tolbert, Dr. Natalia Kotlerov, and Andre Davantel. Also in preparation to join is the Spiritist Medical Association of Uruguay, which is being led by Dr. Perurena. I forgot to say, and I apologize for that, there's another association who is already affiliated to the International SMA, which is France. France has joined us about 3 years ago and is being very active. The Spiritist Medical Association, in Portuguese, is Associação Médico Espírita, and in Brazil, it's known by the acronym AME, pronounced AME, which means, in Portuguese, love. And love is the core of our mission. So this acronym is very appropriate, but unfortunately, it does not translate as an acronym when we say it in English. So, but what is a Spiritist Medical Association? It's an organization led by physicians with the main purpose of bridging medicine and spirituality. Our main target is the healthcare professional who delivers medical care to our brothers and sisters, to our parents, to our kids, to ourselves. So The healthcare professionals are the providers, but the beneficiary are the patients. To them is what we dedicated our work. Don't we want a professional who treats us with compassion, who gives us the attention to both our needs, the emotional and the physical, who understands and respects our beliefs, and who is present when we most need? That's the professional, is the healthcare, the doctors, the professionals that we really would like to have. And I know that majority of the physicians, the healthcare professionals already work with those tenets that already work in this way, giving attention, compassion, and tending to the emotional and physical needs at the same time, who understand and respect the beliefs of their patients. But we want to bring this to more and more and more healthcare professionals, so that one day this is going to be a norm for everyone. So that's what spirituality in healthcare entails. It's not only to ask, what is your religion, where is your beliefs, but also to follow on that and help the patients in that way. So how do we work as an association? We work by promoting conferences, publishing articles and videos that shed light on the spiritual nature of the human being, to share knowledge about the connection between mind and health status, to share research data on the beneficial effect of spiritual care and spiritual practices. And these are very important because there's a lot of data there. There's a lot of research that have already been done on spirituality, on the benefits of spirituality in healthcare. Spirituality helping us to recover better, to heal. And not all physicians in different types of specialty have access or have been interested in that area. But sometimes when we bring a video, when we bring a conference, then they get awareness, they get broader knowledge on that. So why, this is a question that I get many times, why are Spiritist medical associations led by Spiritist physicians? Well, first, because it's founded by Spiritist physicians. But Spiritism, Spiritists, because the concept of Spiritism help in understanding the interaction between the troubles of the mind and what goes on, what is manifested as a disease, as an illness in the physical body. It also helps in understanding that the illness that afflicts us today may reflect our own experiences from a previous life. And it helps in understanding that faith ultimately leads to healing the soul. So we can cure a disease, but if we don't heal the patient, the disease may come back and may come back even worse. So it's important that as a physician, as a healthcare provider, we have this concept that we need to care for the physical body, but we also need to tend to what's going on in the soul, what is going on in the mind, the emotional part of the patient. It's very, very important that we work in both ways, and we work to promote an integrative care that takes care of mind and physical body. So why is this an association that is led by physicians? Because a medical doctor knows how the human body works, knows how to interpret symptoms and signs of an unhealthy condition, and most importantly, knows how to communicate with other professionals, other colleagues of the healthcare professional in technical terms. So it is easier to relate to colleagues in technical terms, and then it's easier to bring the concepts of Spiritism, the concepts that a human being has a spiritual nature, that we have many lives, and that experiences from past life may be affecting the present life. And all of this is very important to take care of our patient in a very integrative approach. Who can be part of the board? President and vice presidents usually are physicians, but other members of the board may be some healthcare professionals or other professions. So sometimes it's much easier to have somebody who understands better the finance world to be finance director of our associations. Who can become a member? This is pretty much in the context of each association. So regional associations, national associations, they have membership, individual memberships, and they also have other associations that are affiliated. So for example, in a national association in Brazil, there are so many associations, and the Brazilian Spiritist Medical Association has number of affiliates from all different states. And sometimes in the same city, there are several associations too. The international association is a little different. It's only offers membership to national associations. So our affiliates are representative of different countries. So I hope that I have shared with you some information of how the Spiritist medical associations work. But if you have any question, if you want to talk to us, there's our email there, sma.int2020@gmail.com, that you can, of course, get in touch with us, ask your questions. Our website, we have a new website under construction, so we don't have it yet with full information there, but we already have one that we had an announcement from our Congress last year, and there are several videos from the last Congress in there. So you can visit that and have more information. And of course, as an international organization, we are here to support our affiliates. We are here to inspire new affiliates. And to that, I would like to end wishing the best for this Congress, which, of course, it's going to be a success, given the fantastic body of speakers that have been selected. And I wish the best for our newest affiliate, the British Spiritist Medical Association, and may Dr. Marlene Nobre, who is in the spiritual realm now, be always with us and help us to move forward with this mission that we have. Thank you all.